Hey everyone, it's great to see you again. If you're new here, my name is Justin Lee, fitness coach and third-year physical therapy student. Here you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. This channel is all about lifting others and lifting weights. So if that resonates with you, feel free to subscribe and let's lift for change. Alright, so we are on episode number 2 of the Student Speak series. The first episode, I had tons of feedback on it. People loved it. A lot of pre-PT students said they were more interested and couldn't wait for the next series and the next episodes to come out. So finally, episode number 2. This episode I'm really excited about. We have a ton of great people who are going to be talking here today. For those of you who don't know what Student Speak is about, it's a YouTube series that helps promote different DPT programs across the nation so that when a pre-physical therapy student starts applying, they can look at this series and see the different types of DPT programs across the nation and get a better insight on what's going on and hopefully get a better understanding if that school is a right fit for them. One of the bigger reasons why I created this series is that you'll find a program online and everything will be so staged. They'll have all the highlights of everything of what that program entails and what they have, but it doesn't really give the insight from the student's perspective on student life of what it really means to be a student there. So I figured let's get over that obstacle and talk directly to the students so it can bring value to you as to which program would be the best fit. Alright, so in this episode we have Beana Richardson from Alabama State. We have Cheri Chan from University of Southern California, aka USC. We have Matra Henderson from St. Augustine in Texas. And finally we have Brandon Pasqua from West Coast University. Alright, really quick before I get into this, I'm calling all current DPT students who want to share in the Student Speak series. Your voice matters, it brings value, and other pre-physical therapy students that are interested in your specific program, you will bring so much value to them. So if you're watching this, or if any of you know any physical therapy students that are in school right now, please have them contact me, comment their names below, or send them their DMs, or DM me, slide them out DMs, and let's get in contact so that we can help lift others up. Alright, so let's get this episode started. As you're watching this video, and if you found that some of these students were very helpful to you, please comment below and write their names down and shout them out so that when they share this video and when they view how they impacted you, it really means so much more. And honestly, this is why these students have volunteered, because they just want to help you be successful in applying to DPT school. All right, let's get it, baby. We got Alabama, USC, St. Augustine, and West Coast University. Here we go.
Hi, my name is Beana Richardson. I am a first-year student at Alabama State University in Montgomery, Alabama. I just wrapped up my second semester, so we're heading into our third and final semester of the first year, and I'm just going to share some things with you that I have enjoyed so far. So one of the most unique things about my program is that we're really big on interprofessional education. So within the College of Health Sciences, there's physical therapy, occupational therapy, and then one of the few prosthetics and orthotics programs in the country. And so throughout the first year, a lot of our classes are intertwined with each other. So gross anatomy we had with the OT students and the P&O students. And then some of our other classes we'll have with just the OT students or just with the P&O students. And so I think that's really beneficial because obviously we're going to be working with these people once we get out of school. But also just while we're in school, it's really nice to just have that other point of view because OTs are obviously thinking about some other details than PTs are, than the P&O students are thinking about other things than we are. And actually, I think it's really helpful that we get different points of view looking at the same thing. Another thing that I have found really unique about this program is that our class sizes are really small, and that's intimidating but also really helpful depending on if you're in the program or not. So every year our program admits about 24 students, and of course it's really intimidating when you're interviewing and they tell you they're only going to pick 24 out of the 100 who have applied, and I just think it's helpful during the program because Obviously, smaller class size, you're closer as a group, and then you also get more one-on-one time with professors, especially if there's more than one professor that's teaching the course. So I think that's really beneficial for us, being a small program. Another thing that I've enjoyed so far is the very casual atmosphere. Not only do we get to wear, t-shirts and shorts and leggings and everything to class every day, but just the atmosphere in general, being able to talk to anybody at any time. They're so open and welcome, and obviously if they're not busy, then they're more than willing to just sit and talk to you. I don't know if that's just a Southern thing, but I think it's an advantage that the professors and the staff and everybody is just so willing and always available for us. Another thing that I've enjoyed so far is the fact that we don't have class on Fridays. It's really helpful, especially throughout the first year when you're literally just figuring out, because obviously undergrad is way different from grad school and how you study, and so just having that day off, because sometimes we would have study sessions and everything, but just having that day to kind of regroup and review or start a topic that you've been kind of putting off, or just take some time to relax. I think it's really helpful that we get to take that day to ourselves for the most part. Another thing that I have enjoyed, and I think that is a really huge advantage, is the fact that we get our own cadavers, and we get to dissect them in gross lab. I know a lot of schools that might have like medical programs attached to them. The med students might get them first, where they have to share or things like that, but we're the only people who are dissecting cadavers. So I think it's a really great thing for our learning to be able to dissect them from start to finish and just be able to take everything in. And the last thing that I'll say that I enjoy is the fact that our professors, a lot of them are currently practicing clinicians, and I think that's helpful because they get to not only just teach us what's in the curriculum, but also add their techniques and their special tidbits that they might do or that they have found helpful over the years. And another thing that I enjoy about the professors is that we aren't just learning from PTs. So like I mentioned, that it's interprofessional program and curriculum. A lot of the interprofessional courses are taught by PTs, OTs, and P&O clinicians. So, I think they really, really try to have a mix of professors. So I think it's helpful that we get to learn from other professions. And of course, like I said, with the students, they bring things that we might not have thought about, or things that we need to keep in mind while working with future OTs and P&Os as PTs. So I think that is a really good advantage that we're learning from other professionals. And so that's all I have. If y'all have any questions, just let me know, and thanks for listening.
Hi everyone, so I'm Cheri, and I'm a second year DPT student here at the University of Southern California, also known as USC in Los Angeles, California. So I'm going to talk about 3 big points that led me to choose USC in the end. But real quick, there is a residential and hybrid program now at USC, and as a residential student, that's what I'll be talking about. The incredibly accomplished faculty that you will meet here are all on the top of their field, whether they're currently a practicing physical therapist or doing research. They have published numerous publications, articles, textbooks, so it makes learning even better because we learn straight from the source. For example, Dr. Christopher Powers, he's the president of the California Physical Therapy Association, and we just learn straight from him. And a lot of other people that I've met have mentioned him, cited him, and it's awesome that I actually get to build a personal relationship with him here because the faculty are so approachable. They want to help you, and they just want nothing but the best for you. And it's incredible to build a one-on-one relationship despite the big class, which I will get to later on. And you might even be working with or alongside them after you graduate. Another thing that drew me to USC was patient interaction during the first semester. A lot of programs that I applied to had patient interaction in the second year. And in the first semester, we had 2 inpatient experiences where we got to observe PTs in a hospital setting and actually practice our interview skills with real patients. And we also got the opportunity to go to a local elementary school and work with kids, do our assessment skills and play with kids. And it's a lot of fun, especially if you're thinking the pediatric route. During your time here, you actually get about 50 weeks of clinical experience, which is basically a third of the curriculum. Nothing can beat that. Just practice, 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 real skills, real patients. It's amazing. And the third point is, even though there are about 95 to 100 students in the cohort, plus the hybrid, so a total of about 150, I never felt that it was as big as it may seem. For example, like in one of our classes, we split into smaller groups with small group leaders like the faculty, so we get to practice with a variety of bodies, a variety of people, and practicing one skill on 10 different bodies is only going to help you become a better clinician, because every individual that you will see is different. And so I never felt that I wasn't getting the help that I needed, because there are so many classmates, so many faculty members that are there to help. And as a side bonus, there's so much to do here in LA, from sports games, but go Giants, to trying the newest restaurants, and being so close to the beach. I hope this gives you a really small insight into why I chose USC, but I wish you the best in your application process and your doctorate journey.
Hello out there. My name is Matra, and I'm a student physical therapist at the University of St. Augustine in Austin, Texas. Before I get into the details of the program, I want to talk about the location, because where you're going to live for 3 years is a huge part of where you're going to school. So Austin is considered like the LA or the Los Angeles of Texas. There's so many hills and valleys, so many outdoor activities. It's so green, and there's just so much to do in the city. You can float the river in an inner tube. You can go to Lady Bird Lake and kind of kayak, swim, or canoe. Or there's just so many outdoor coffee shops with such a great scenery for you to sit down and do your studies. So Austin has a lot to offer in terms of food and activities and music and festivals, and it's just a really cool place to consider going to school. Also, being in a program located in Texas, we have an opportunity to compete in the PT Olympics. What that is in San Antonio, a lot of the Texas programs get athletic teams together and compete against each other. So it's a really cool way to let off some steam, but also network with other PT students in your state. The University of St. Augustine Physical Therapy program caters to more than just physical therapy students. It puts a lot of emphasis on interdisciplinary education. So you do have an opportunity to collaborate with OT students and SLP students, which pretty much makes you an overall well-rounded physical therapist, because you have an opportunity to truly understand the role that each discipline plays in providing the best outcomes and treatment for your future patients. So our program has 2 different options for you to pursue your PT dreams. There's a residential program that I'm in, where you come to campus every single day, and it's full-time, and it's actually accelerated, so you're getting your DPT in about 2 years and 8 months. Then there's the flex program, which is a little bit more flexible. Pretty much all your work is done online, but it can be done remotely from anywhere in the country, as long as you're able to come and do your tests and practicals on campus a couple times a month. So it's really cool that our program offers options for your traditional students that want to get it done in a quick and in a hurry, but also for your students that have jobs or families that still want the opportunity to get their education in physical therapy. USA also offers work study for its students. As long as you're a second trimester student with at least a 3.0 GPA, you have an opportunity to work different side jobs like the wellness center, a tour guide, or even a peer tutor to earn a little bit of extra cash as you matriculate through the program. And we can all use a little extra cash while being graduate students. USA is a very evidence-based and manual therapy focused program. So much so that a lot of our instructors are specialized in manual therapy. They actually lead a lot of the CEU courses right here on our campus. So you have an opportunity after you graduate or towards the end of your matriculation to participate in some of those CEU courses, and you're getting taught education by people that are truly experienced in these types of techniques. In In terms of the coursework, we have state-of-the-art labs that bring the information that we learn on paper to life in an applicable setting. Starting with the cadaver lab, we have real cadavers that we do all the dissections on, which is really cool and helps us with gross anatomy. Then we have our ICP lab that simulates a hospital setting with monitors and lines that in hospital beds that really make you comfortable with the setting that you'll be in for your clinical rotation. We also have evaluation labs, which on one side of the glass, it's you, a patient in a case, and you're going through a true evaluation. And on the other side, you have your instructors and your classmates that are observing you and providing you feedback from time to time. And then we have our biomechanics lab, which has equipment that measures different components of gaits, EMG signals from your muscles, joint position, or even ground reaction force, which really makes sense of the information that we learn in the textbook. All in all, USA is a really great program. We have the most supportive staff, we're in a great location, and we have state-of-the-art equipment that really helps prepare us for what we are in for in a PT clinical setting.
Hi, my name is Brandon Pasquale, and I'm a second year at West Coast University in Los Angeles, California. First, I'll be talking to you about the curriculum of West Coast University. So it's broken down into 9 trimesters. Your first couple trimesters are mostly going to be didactic coursework, where you're in the classroom learning about anatomy, orthopedics, kinesiology, neuro, and all that fun stuff. Then towards the end of your second year, they're going to send you out on your first clinical rotation. And I really like how this program is set up, just because they're sending you on your first clinical rotation right after they've exposed you to different types of settings. So you've taken all your didactic coursework, your neuro, your cardiopulm, and pretty much you're really familiar with a lot of things than an average first year PT student. Just because I know in other universities, they usually send students out on their first semester. So they usually just end up shadowing, but when I went out on my first rotation, I ended up just being thrown in the fire just because I was ready, and West Coast really prepared me for that. So the second thing I like about West Coast University is that if you're looking to specialize in the orthopedic setting, our orthopedic professors are very highly skilled. They've both completed post-education or post-grad, such as residencies and fellowships. And their teaching style is very remarkable. They let you record them, do certain manual skills, so you're able to keep that recording until you get into the clinic or work in your own practice or wherever you end up after PT school. So it's a really good reference. And they also teach you things they kind of learn in their residency. So it gives you a mindset or an education that is kind of above entry level when you leave PT school. And then another thing I like about West Coast University is that we have Fridays off. So it's pretty rare for a doctorate program to have Fridays off. So we'd be going to school from Monday through Thursday, and classes could be from either 8 to 10, or they could end up from being 8 to 5, depending on what kind of trimester you're on. But they do have some Fridays reserved out of the trimesters where you're going to do some kind of makeup day, such as for a holiday, or you're going to be doing some kind of volunteer work. But it's only maybe 2 or 3 Fridays out of the 15 Fridays of the trimester. So you have a lot of time on your hands on Fridays to catch up on schoolwork or just relax. So that's what I really like about West Coast. So one downside about West Coast University is that the campus we have isn't really a campus. It's more like 2 buildings with a bridge connected on the inside, kind of. So we share our buildings with the pharmacy department, and also MSOT and the occupational therapy doctorate program. So the campus does get a little busy during the fall and springtime, but during the summer there is no pharmacy program. So that's when it's usually empty. All the study rooms are all open, and the library is open as well during the summer. However, spring and fall, it's usually kind of a free-for-all, trying to find a study room or a classroom to study at. Another downside about West Coast University is that when you start applying for clinical rotations or clinical sites, our locations are very limited, especially when you want a certain site that all your other classmates want. And this is just because most of our sites, they're a little mixed. They're not like super close to the area, which is in SoCal or Los Angeles County. Some are in the Bay Area, some are in like even past that, like Sacramento area, some are out of state, like Florida, Michigan, Texas. So it's really mixed just because we just got accredited. So, but my school is doing a better job at reaching out to more sites as we speak. So I know the process is getting better just because I've been talking to the classes before me, and it sounds like that they have had a more difficult time than we did getting into sites. So they have definitely been making it a little easier as time goes by. Overall, I've had such a good experience with West Coast University. I've definitely been learning a lot. The professors are definitely passionate at teaching us what they do. They definitely want us to be better clinicians or better practitioners than they are. And the academic program is definitely challenging for sure, just because it is a doctorate program. But we do have Fridays off, so that definitely gives us time throughout the week to make life outside of class more manageable. Like I was able to still train people part-time for my personal training throughout the week. I was able to still work out myself, stay in shape 5 to 6 times a week. I was able to visit my parents at least once a week on weekends usually. And I was still able to have a decent social life, going out here in LA. I live like 10 minutes away from the university. The university is 15 minutes away from downtown, maybe 25 minutes away from Hollywood itself. So the location is not too bad at all, especially if you're living around the area. So I hope that this video definitely lets you know if West Coast University is the best fit for you.
All right, so I hope these voices from these current DPT students brought value to you, and I hope it inspired some self-change. If you're a current DPT student and want to get featured in this series, please reach out. This channel is all about lifting others up. We're all on the same team. Change people, change people. That's why we live for change people. Have a great one, you guys.